think we'll start in just maybe just one minute. Yeah, Sarah, hope back to school is going well. I have a 4-year-old who is in junior kindergarten for the first time. And I think it was harder for me than it was for her. I don't know. Right. Dr. Gilmer, do you want to kick us off? We can
Sure.
get started.
Sure. Welcome, everybody, and thanks for joining us for our August meeting. And the first slide shows our agenda. We're going to do a quick welcome in lieu of time, skip the icebreaker, and we're going to do a summary of the July session and survey results, then a prioritization of medical home strengths and challenges. Then we're going to begin a root cause analysis of our information. I think that's going to be a really helpful and important part of our meeting. Wrap up and adjourn. So let's go to the next slide. If you could please put your name in the chat and your role in this advisory group. And we'll do that in lieu of a round robin welcome. So just put your name in the chat. Thank you, everybody. I'll put mine in too. Looks like we've got about 18 participants. Thank you, everyone. So let's go over while we're waiting for people to finish that. We'll go over our community agreements. Remember to be open, be curious and non-judgmental. Assume good intent and assume welcome to the group. We want everyone to be respectful of each other. That take space and make space idea is really helpful. Recognize that everyone does not have the same experiences, and we want to be open to what everybody else has to say. Beware of your impact, your intent and impact. So actively participate. That's really important, especially for this meeting. We want everyone to work together. If you're using an acronym, explain it first. Ask questions and clarifications when things aren't clear. You know, if you don't understand it, there's a good chance that someone else doesn't understand it either. So there's no stupid questions. We'd like to send our materials ahead of time. I hope you've had a chance to review them. And we're here for help you out with any concerns or questions that you might have. So keep that in mind. We're here to help you guys out. And with that, I'll pass it over to Sarah.
Great. Thanks, Dr. Gilmer. Good morning, everyone. I'm going to do our review of what we did in our last meeting toward the end of July, I believe. We started our meeting with a discussion around potential impacts of changes to federal policy on our work. Thank you to Amy Zagman for that presentation and discussion. It's an ever-changing topic, so I'm sure there will be continued dialogue around that. We then reviewed the key findings from our environmental scan thus far for each of the medical home core elements, what we've learned from secondary data and the focus groups that in our panel discussions. And then a lot of our time surrounded this discussion of the medical home elements and helping us begin to prioritize what this group wants to focus on. So we did a lot of this discussion through a few polling questions, and we just wanted to share the results with you today. So if you could scroll down just a little bit, Lindsay, so we can see the number on the bottom. Thank you. So we had 27 participants complete the poll. Some completed it during the meeting and had the discussion around it. And there was a few who completed it outside of the meeting who weren't able to attend. So if the results look ever so slightly different, than what you may have seen at the last meeting, that's why. So our first question that we asked folks was, who is in the room today? And to check all the roles that apply to them. And this is just to get a sense of who, what perspectives were represented in our discussion. As you can see, we had 10 folks who identified as providers or clinical staff, 9 MDHHS folks, 8 people who were parents of a child without special healthcare needs, 7 were other partners in the system, 4 were parent of a child with special healthcare needs, and 3 were an insurance or payer representative. And again, people could choose multiple roles. Our next question was, which 3 elements, medical home elements, would most improve children's care if the element got better, if that element was able to be improved? And you can see on the chart here that 27 participants completed this question, and far and away, the most common response was 22 participants who said coordinated care and needed referrals. And when we had discussion around this, some of the reasons committee members selected this was just that they really felt they heard this strongly from parents, that this care coordination element was really critical. Coming in second and third was the accessible care and payment structure elements, with accessible care being important because accessibility is, you have to get care in the first place in order to improve your outcomes. And then funding, in order to have a payment structure that really supports medical home and patient-centered care, they saw that as, that would really be necessary in order to improve that. Our next question that we asked people was, which 3 elements of the medical home would be hardest to improve or change? This would be hardest to impact. And the top response was payment structure. We know that it's complex and slow to change payment structures. The second piece was accessible care. And the third piece was coordinated care and needed referrals. And when in discussion around these pieces, people mentioned that improving things like access involves addressing pretty large issues within the system and could require some mass system changes to make those things happen. And 22 participants completed that question. So our final question was to look at the intersection of what would make a lot of impact, but could also be feasible for this group to accomplish. So we asked participants to answer this question: which 2 elements seem most doable and important for this group to work on improving? And this was a prioritization of what we want to focus the rest of our work on. And the 2 that rose to the top were compassionate care with 12 votes, and coordinated care and needed referrals with 11 votes. And some of the reasons that were given for these elements rising to the top were that these felt potentially achievable through public health strategies that Title V can be part of and influence. So things like training, partnerships, consistent practice, that there was just a lot of opportunities that can be worked on, and even in an environment of shrinking federal investment in healthcare, that this would be a place where we could still maybe make some impact. So based on this discussion today, we are going to focus on these 2 selected medical home elements. And we're going to do a deep dive into each of them and review what you all identified as the strengths of our current system for each of these elements, as well as the challenges in our current system for each of these elements. And you'll see points from secondary data as well as the data that we collected in our panel discussions and our group dialogue. Are there any questions about this review of last meeting? Okay. Hearing none, you can always stop us in the future. But as we kind of dig into this discussion, we wanted to center us first on our vision. Now, this should look familiar. This is the vision we decided on as a group several months ago. And it's around this idea of what will success look like in 3 to 5 years for this group? You know, what are we really aiming for? And we identified this success would be improved access to comprehensive care, measurable positive health outcomes, and expanded implementation of kind of a medical home approach. And so let's keep that in mind as we are kind of thinking about potential strengths and challenges. You know, what if we change these elements, what would get us toward this vision? With that, I'm going to hand it over to Jessica to discuss kind of our scope for the discussion.
Thank you, Sarah. Good morning, everyone. We just wanted to remind folks that, you know, that the Title V Maternal Child Health Block Grant, you know, it sort of has particular, you know, lanes that we need to stick within, but that doesn't mean that we can't be, you know, working on things that the group raises with partners by partnering or elevating with different audiences as we need to. So please can, you know, please have, you know, please have good discussion. Please put your thoughts out there, but just know that we are trying to narrow in our focus a bit to make the best use of the resources that we have to support this project, but we do want to capture all of the thoughts and feedback that you all have, because you all, you know, have experiences and expertise that we know you all have experiences and expertise that we want to capture throughout this process and be able to sort of make others aware. And this slide is just to sort of show you some examples as to how those thoughts and ideas can be translated into the work. And I think as we walk through this process, we'll start, as we prioritize a little bit, we'll talk a bit more strategy, or sort of start talking that strategy piece in later meetings. But yeah, so just know that while we are trying to sort of narrow the focus a bit, we don't want to lose opportunities for collaboration and pulling in other folks. So thank you, and I am turning it over to Gloria.
Thank you, Jessica. So I'm going to go through some of the strengths and challenges that we identified for these two medical home elements. Some of these will look a little familiar to you. We did go over these at a little bit of a higher level during our last meeting. So this is a little bit more detailed, and hopefully you all had a chance to take a look at, we sent you all this document. If you haven't had a chance to look at it, that's okay. This is there for reference if you would like to take a deeper dive into it. I'm going to go through, we have both a full text version that has a little bit more detail, and then a shortened version, which is what y'all are going to see later on in our prioritization matrix. So I'm going to just read through those real quick. The shortened version, again, if you would like to see more detail, please refer to the full text version. But I'm going to read through them and just pause real quick after a few of them to see if there's any clarifying questions that you all have about what these mean. So starting with coordinated care and needed referrals. The strengths that we found for this medical home element are that parents value care coordination and being a decision maker in the referral process, that Medicaid can cover both in-person and virtual care coordination, and that clinical staff working with a physician, nurse practitioner, a PA can bill for care coordination. It doesn't need to be the primary care provider. And that the Children's Special Health Care Services program offers care coordination for children with special health care needs. So I'll just pause there for a second to see if there's any clarifying questions on these. All right. So if you continue to have questions, feel free to put them in the chat too, and we can get to those. So starting to look at challenges that we found. Starting with, found that non-Hispanic Black families are less likely to report receiving needed care coordination compared to non-Hispanic white families and Hispanic families. We found that parents of children with special health care needs are less likely to report receiving needed referrals and care coordination than parents of children without special health care needs. We found that communication challenges between healthcare settings and system players like insurance, hospitals, that can impact care coordination. We found that it's financially difficult for clinics to maintain a care coordinator position, whether that's full-time or part-time, kind of whatever is needed. We also found that staffing shortages in clinics can divert care coordinators' time and attention away from doing their assigned care coordination tasks. And that also that onboarding for new care coordinators is it's a lengthy process. So I'll just pause there real quick to see if there's any clarifying questions that you'll have about these. Okay, for the sake of time, we'll move on. But again, if you have anything that starts bubbling up, please do put that in the chat. All right, and a few more for this one. We've got also found that care coordinators have a high turnover rate and high rate of burnout. That care coordination and accessing specialist referrals is difficult, particularly in rural areas, requires lengthy travel for patients to get to those urban areas that have more specialist providers. And we also found that it's difficult for practices to stay up to date with patient contact information. And this particularly for folks who maybe don't have stable housing or are changing housing often. We found that social determinants of health needs are difficult to address across the board for lots of different healthcare settings. And that providers and staff are often confused of how to bill for care coordination services. So any clarifying questions on those before we move on to the next medical home element? Okay, we can move on. And again, if you continue to have questions, please do put those in the chat. All right, so the next medical home element that we're focusing on is compassionate care that centers the family and their culture. And the strengths that we found for this one are that parents value being respected partners in their children's health care. We found that the Children's Special Healthcare Services educational programming helps parents of children with special healthcare needs build skills and confidence in managing their child's healthcare. And we heard that peer-to-peer models in which families are learning from each other are a promising approach for developing families' advocacy skills. Any questions there before we move on to challenges? All right, so we can go ahead and move up. All right, so for this one, we have that we found Hispanic and non-Hispanic Black families are less likely to report receiving family-centered care compared to non-Hispanic white families. We found that families are not often aware or often not aware of what a medical home is and the services provided under a medical home, and sometimes not even aware that the practice that they take their children to is a medical home or not. We found that interactions with front office staff greatly influence families' experiences receiving care. We found that staffing challenges and limited time make it difficult for providers and office staff to give families individual attention. And we also found that providers and staff need additional support and education in providing family-centered care. I think there's just one more on this one. Yeah, so we can read through that too and then ask for if you'll need any clarifications. Found that we'll need strategic approaches to preserve and foster timely, high quality, compassionate centered care, particularly kind of in the current environment that we're in politically. So any clarifying questions on these?
When we talk about peer-to-peer interactions under the strengths, peer-to-peer models, is that the same as the community health workers? Is that what the model we're referring to? Or is there other models that we've discussed?
I think that that was brought up separately from the community health workers. But do also want to highlight that, you know, community health workers, we also had some good discussion about the role that they play, in particularly in care coordination. So definitely don't want to lose that. So thank you for highlighting this. But I think this particular point that was brought up was around kind of family to family education. So yeah, but thank you for that question. Anything else? All right. So if you continue to need some clarification, we're going to be looking at these as we prioritize them. So there'll be opportunities to get some more information on these. But I'm going to pass it on to Lindsay.
Thanks, Gloria. So now we're going to start diving into having some discussion and to talk about prioritizing different pieces from each of the medical home elements that we've discussed today and that you all have voted on as those that would be most important and impactful to move forward currently. And so what we have done as an internal team and also with the core team is to take the different strengths and to take the different challenges that were uncovered that Gloria just reviewed and to put them on a prioritization matrix, which you can see right in front of you. And I know it's a little bit zoomed out, so I'm going to talk about the whole matrix and then we'll zoom in so that you can see a little better. So each sticky represents either a strength that we talked about in terms of care coordination or a challenge. And so on the board, you can see it's divided up into 4 different sections or quadrants. And we've labeled them A, B, C, D. And the 2 different levels of the matrix are how easy is it? So if you think back to math class, right? Like on the x-axis, you're like, how easy is it for Title V to either change this or expand or enhance it if it's a strength? And on the y-axis, it's terms of impact. How impactful if Title V were to prioritize this piece to either change or expand, how much impact would it be on families and children to work on this right now? And so this particular table, there's 2 tables because there will be one for each medical home core element that was prioritized. And we'll talk through each one. I want to elevate that this placement of all of the sticky notes, they're drafts. So we encourage you to look at them critically and bring your expertise and experience to this discussion. And if you're like, Lindsay, this sticky does not belong in this area, and this is why, we'll bring it to the entire group, and that's totally fine. Like, that's what we want you to do. So If you have different ideas for where the sticky notes need to go, if you think that it's more or less impactful or maybe harder to change than where we put it, you can let us know and we'll vote on it together as a group. So what I want to do, I'm going to zoom in just a little bit. I'm going to put this in present mode. I think it's a little bit, I think it zooms in a little bit here. So I'm going to zoom in. This one, remember, is about care coordination and needed referrals. It kind of cut off that heading. But I just want to ask you all, as you look at this, sort of as a general overview, if you could type some words in the chat, just one word describing your first impression of sort of the overall spread of the stickies on the board. Like, what are your initial sort of gut reactions when you take a look at this? And remember, this one is just for care coordination. Go ahead, type in one word in the chat describing your initial gut reaction to the overall spread of stickies, and then we're going to have a moment to zoom in, so you'll be able to see a little better. Or if you want to come on off of mute too, if you don't want to type in the chat. What's one thing, one reaction to the spread of stickies on the board? Complicated, complex. Yeah. Thank you. Yeah, maybe we need a challenging. Yes. So what we hope to do today with the discussion, maybe it's a lot when you're looking at it right away, is sort of process and think about, like, what could Title V do first that they should tackle. And these stickies, just to give a better understanding, will be the ones that we vote on, that we'll be voting on 2 today, to move forward, that will develop sort of really key actionable strategies and do a root cause analysis for. So these ideas are all super valid, all very important, but we need to think about what we can do first. What's most feasible to do first? So I think what we'll do is I'm going to zoom us in to sort of the first half of the board, those that our team sort of proposed as a draft. Might be a little bit easier for Title V to change either or expand if it's a strength. And those that either had the most impact or some impact. So I'm going to see, can we read that okay? Okay. So I'm going to walk through the different stickies that are in sort of these 2 columns. And I want us to think about, how do we feel about where they are? Do you think they belong somewhere else on the board? Maybe they should be shifted around. And so I'm going to read them. And if you all have any questions about why we maybe propose that they go here, I'll invite you to sort of raise your hand so that we can make sure that we address that as well. We also have numbered them to make it a little bit easier to refer to if you're like, hey, I think number 1 should go somewhere else. So just so you know, that's why that they're numbered. They are like that. Number 1, parents value care coordination and being a decision maker in their referral processes. So these are the ones up here, and they are put on the board depending on where they think they would make the most impact. So if they're higher, that means that we propose that we could maybe make a big impact if we address these. And if they're over here on to the right-hand side, that means that we feel we're proposing that it might be easier for Title V to change or expand. So number 1, parents value care coordination and being a decision maker in referral processes. Number 2, non-Hispanic Black families are less likely to report receiving care coordination compared to non-Hispanic white and Hispanic families. 3, providers and staff are often confused on how to bill for care coordination services. 4, clinical staff working with a physician, nurse practitioner, or a PA can bill for care coordination. And then 5, Children's Special Healthcare Services offers care coordination for children with special healthcare needs. We have one that's underneath that maybe was proposed would make slightly less impact, but would be relatively easy to change or expand. And that's Medicaid covers in-person and virtual care coordination. So I wanted to pause here and ask how we're feeling about where these different pieces are on this board. Do we feel like any of them should be in a different spot? Are any potentially might be harder to change? Thanks, Kayla. Kayla said she thinks they look good. Are there any that might be harder to change than what we're proposing here?
I don't know if I'm following this exactly correctly, but
That's okay,
I think
Kara. Go ahead.
if I am, I think it would be hard to, for number 2 to change the comfortability of, them families, the, Black and brown families to, join the, like to get, I don't know how we can, I don't know. That one just seems like it might be a little bit harder than to reach because of trust issues and the complexity of that whole thing. Because I think it has a lot more to do with than just coordinating,
I
like
see.
past trauma and trust and all other stuff.
Thanks, Kara. How do others feel about that one?
Not saying it's not important though, because it is
Yeah.
very, very important, but
So you're saying maybe it's not as easy as where it's currently sitting. Is that what I'm hearing, Kara? Like maybe it could be shifted to a little
yeah,
bit
I
more
don't think
difficult?
it would be as easy to accomplish, I guess, or it may be more difficult than what we're maybe thinking.
Thank you. How do others feel?
If it's closer to the top compared to the middle line, that means it's harder to change.
So that's a really good question. So I'm going to zoom out just a little bit. So if it's closer to the top, that means if we addressed it, it would make the most impact.
Mhm.
It would really be impactful. If it's way down to the bottom, that means it would make sort of some impact, maybe not quite as much. If it's over to the right, that means it would be really super easy to, not super easy, but it would be easier for Title V to either change or expand. If it's all the way over to the left, it might be more difficult for Title V to actually do something about. Yeah, I know. It takes a minute to sort of get used to this. I understand. But I appreciate the question, Tia.
I do too, because now I understand it a little bit better.
Oh,
So thank you
good.
for asking that question to help clarify. So I think it is definitely most impactful, but I think it needs to go to the left a little bit more for the number 2.
Okay, so here's, and I'm glad that you're modeling this, Kara. So what we're gonna do is we're gonna put a vote in the chat. We're gonna do a rapid chat vote. So if you feel like you agree and you think it might be a little bit more difficult to address, then we can put move in the chat. If you want it to stay where it is, then you type keep in the chat. So let's take a minute. Either write move in the chat, doesn't need to move, or should we keep it? Okay, I'm seeing a lot of moves. So I'm going to zoom out. I heard that it's really important to address, but it might be more difficult to do something about. So I'm going to take this do you think, and Kara, I'm gonna come back to you. Do you propose that it should be moved like here? Or do you think it would be over across the line? And I guess anyone.
It's just a hard one because I think it has to do with, I mean, I don't know, it's hard in my opinion because one, I'm the counterpart, you know, like I don't have the feelings that the families that we're discussing about would feel. So I
Mhm.
don't know where they're coming from, why they have the distrust, but there is the distrust. So we, you know, the providers could approach it and try to, like, the thoughtfulness would be there. I just don't know how receptive it could be or what it would take to make it better.
Mhm.
It's a hard one because it does, in my opinion, it has to do with a lot of emotions as well. It's not like a strategic plan where we can put things, you know, it's actually dealing with people's emotions and fears and all that kind of stuff. So you don't really know where exactly that's gonna be. I'm not helping. I don't know. So someone else.
No, I think that you are. I think this is what we exactly are hoping for, Kara. So thank you. I think we want to talk it through, and I think that helps us to understand and make sure that we all feel good about where it goes. So, uh, with this, so we can say like maybe, and to Kara's point, she shared perhaps providers could potentially do something and work hard to address this, make them feel more comfortable, do more efforts. Maybe we can't directly influence, or we could do some education around this. So I'm wondering, do you all feel like it would be, in terms of ease or difficult to address? We just need to figure out which part of the line we want to put it on. Is it more difficult or is it easier to address?
So this is Annette. I would favor putting it on the easier side to address, only because we can target that population and do further work with the specific population. It makes it a little easier to address. And I'll just say that sometimes if you're working with you know, a marginalized or a different population, that um, maybe the impact isn't going to be as great. I was looking at the Children's Special Health Care Services offering coordination of care, and I thought, yeah, that's something again we could focus on because we know who that population is and we can address it directly. But it's a smaller group of people. So would that make it less impactful?
Okay, so I heard two things,
Two
Dr.
different
Gilmer.
things there. I
Yeah,
apologize.
yeah.
Yeah,
No, that's
yeah.
okay, but I think they're both important. So I heard a proposal to keep number 2 in easier to address because we can make efforts to target and do interventions with specific populations, and we know, who they are. I want to stop there and see if you all could give me, if you feel like that's okay, if you agree with that, if you can give me a thumbs up. Or if you disagree, maybe you can come off mute and tell me like why. No, I think this actually needs to go into difficult. Oh, a burst of thumbs. That's pretty cool.
So
Okay,
I'm going to speak up on the
sure.
side of moving it because how people feel they were treated and how they interact and everything that Kara said is in fact a social determinant of health. So if we're moving social determinant of health way over to the left and that is a social determinant of health, why are they so far apart? That doesn't really make a lot of sense to me.
Are you talking about this, the non-Hispanic Black families and then number 8,
Yep.
Chrissy?
Yep.
Okay. So are you proposing that they move together? Do you, I mean, because we
Possibly.
can
I
move,
mean,
we
they
can
could
move
be.
these, yeah.
There, I think it might be a little bit easier to address than say an environmental change in terms of, infrastructure, as a social determinant of health, but they should be a lot closer together. Maybe not entirely parallel or overlapping, but they definitely should be closer together.
Okay. I
And
wanna,
I
oh, go ahead, I'm sorry.
And I think, to Kara's point, some of that trauma is generational. And so just saying, well, we're going to reach out to them, it's not going to be a flip the switch and now everyone's happy. This is, multi-generational trauma.
Sure, sure. Gloria, did you have something you wanted to add to what Cressy was saying or an explanation?
Yeah, I just wanted to kind of clarify with this data point. It's coming from the or the National Survey of Children's Health, and we don't exactly know the reasons why, all of the reasons why families are reporting this. So I just want to make sure that we're thinking not just about that, potential piece of mistrust and trauma, like that could definitely be happening there, and a reason why families are less likely to report receiving that care. But I think another thing to keep in mind is that families may be reporting that because their providers are not providing that service. And so when we think about the kind of easier to change, not easier to change, that could be a really big piece, because we can have some impact with provider education on making sure that providers are providing that service across the board to all of their patients, and working with providers who work with predominantly Black patients. So just wanted to put that out there as like another potential reason of why we're seeing that data point.
Thanks, Gloria. So do we feel okay about keeping number 2 where it is, just for number 2, if we're thinking about where we are? I saw Tia's head nod, but I can't see anyone else. So if you could, a thumbs up. I just want to resolve this one so we can move forward. Okay, cool. So I'm going to leave number 2. I want to talk about 5 because Dr. Gilmer proposed that first. So I heard you, and Dr. Gilmer, tell me if I'm misunderstanding or speaking wrong. You said children's special healthcare services, you wanted to elevate that this is specific for a particular population. And maybe when we're talking about level of impact, that it might belong a little bit lower since we're very, very focused on a specific group.
Yeah, because I'm also looking at the Medicaid, number 15 is under the line for impact. And I'm thinking in my mind that that's why that's there too, is because Medicaid is a smaller population and therefore, functioning, working on care coordination, coverage, reimbursement would just impact a smaller number of people. I guess I'm assuming that's why it landed there. I can't be sure, but if that's the case, then I would say this Children's Special Healthcare Services offers the same impact.
Okay. All right. So oh, sorry. Go ahead, Sarah.
I believe part of why that landed there, and team, correct me if I'm wrong, is that that we could kind of educate more folks around how to bill or get reimbursed for in-person and virtual care coordination as it exists currently through Medicaid, because it's not commonly billed for. However, it is a relatively small reimbursement. So in terms of the amount of impact that would have in increasing capacity for a particular provider to provide care coordination might be lower. So I think that's why it's in some impact, but I think your point also stands, Dr. Gilmer.
Okay, thank you for all of that. So the proposal is to take, and tell me if I'm wrong, Dr. Gilmer, would you move this down below so it would be in line with Is this the proposal?
Yeah,
To move it down?
yeah,
Okay.
that would be my proposal.
Okay, so we're gonna vote for move or keep in the chat.
Okay, I'm
I'm gonna-
sorry. I
Yep.
don't know if I'm not following, not understanding, but are we saying that groups that are smaller ratios don't make as much of an impact or don't matter as much as the greater population?
Well, I hate to say it that way, but I'm just looking at the impact of a small group versus maybe something that's more across the board. So yes, maybe the way you're saying it is correct.
So bluntly, and I guess even kind of rudely, if we're like the most impact would be to try to how we can affect the larger population than the
Well, everyone, as opposed to just focusing in on a small group, I guess. Does
So I
that make,
think,
yeah.
yeah, I think we're trying to pick the priorities. What could we do and what could we do right now that would make the larger impact for the most people is sort of what this prioritization matrix is asking. Not that those kiddos don't matter, because that's certainly not the case. They absolutely matter. It was just what is the largest number of impact? So could be, yeah, it's some impact, but it's not in terms of numbers, the largest impact.
Yeah, and please don't misconstrue that I mean that this is a lesser important group or somehow not important at all. It's very important. I'm just thinking impact to me means overall, the overall, I don't know how to, the impact is impact. I don't know another word for it actually, but for a broader group of people.
okay, I just gotta turn my mindset around because usually my mindset is always for the, I guess, the special need kiddos or the minorities. So to all of a sudden not put them in the forefront is very odd or very different train of thought for my mentality. So I'm like, wait, what are we doing? Yeah, I'm always the underdog, I guess.
Well, you have a point. You have a point, and I guess that's why I brought this issue up along with the non-Hispanic Black families, because it's the same idea that impact can be really important very important, but it's for a smaller group of people.
Monique put in something in the chat that I think is really important. I want to just elevate it to the group. So she said number 5, the sticky, highlights something a little different from the barriers. It's pointing to an existing strength so that they're already offering care coordination for these kiddos. That's an important resource, especially for this population. And even though it reaches a smaller group, we can think of it as an opportunity to build on what's already in place. So if this was selected, this would be an opportunity to expand what's already there. So yeah, thank you, Monique, for elevating that. So for this, we're simply sort of looking at it as the amount of impact, and I guess it would be a huge impact for this group if we picked that one. And then how easy or difficult would it be for Title V to either expand it if it's a strength in this case, or to make some changes if it is a challenge? So we proposed, just circling back, proposed to move this down, that it might be easier for Title V to expand this, but the impact of it might be on par with Medicaid covering in-person and virtual care coordination. So impact would be a little bit smaller. So and it can go either way. So I'm gonna let everyone decide whether we put move or keep in the chat. And then the winner is the winner. So we have, yeah, Gloria, that's a good point too. Do we have our special healthcare folks that want to talk about this or weigh in?
This is Tara. I think it's an interesting conversation. I'm not sure given our current landscape, I'm not sure about the capacity for expanding. But also not sure that it would be expanding as much as like making the systems more efficient potentially.
Mhm.
So I think we would just need a little bit more information, but obviously we're committed to the project.
Thank you. What, just out of curiosity, what would be your vote, Tara, if you don't mind? I know I put you on the spot.
No, it's good. I really appreciated the conversation around impact because I think that that's just like such an important definition to work with when you're looking at a matrix that goes from most impact to some impact. I
Mhm.
really valued that conversation. So I would probably leave it where it is if it were me, because I think, yes, impacting more people, I understand that portion of it, but the amount of impact for these specific families is potentially much larger than maybe the general population. So I see it kind of like in the middle, it's kind of in a middle ground. And so I probably wouldn't move it.
Okay, thank you. Thank you, Tara, for that perspective and for allowing me to put you on the spot. I appreciate that. Okay, friends. Oh, Sarah, go ahead.
I was just gonna say, should we just take a vote on it?
Oh, yeah, and I thought Sarah Davis might want to say something. I saw her come off mute.
Thanks, Lindsay, and thank you, Tara, for jumping in. I was also just going to share because I think part of the original conversation was sort of talking about the Medicaid piece and the CSHCS piece. And I think an important distinction that Tara kind of touched on, and that I think, everyone is aware of, that CSHCS sort of directly falls under that Title V umbrella, which also might be a reason that it was originally in this upper right quadrant, because of the potential ability for Title V to like address an impact for that. For children with special health care needs and their families. So I would probably, to put myself on the spot, I would probably agree with Tara in terms of leaving it in that quadrant, but defer to the group.
Okay. And then Monique had a point in the chat that since this resource is already in place, it may not need to be top priority for Title V right now. Instead, we might want to focus our energy on the areas where no support currently exists, so where families and providers are experiencing and identifying gaps. Thank you for that. Okay, let's do a quick vote so we can move on to other topics. But I do appreciate this conversation. I'm just trying to keep an eye on time for us. Okay, let's keep or move in the chat, please. And then Gloria, if you could kind of keep an eye on that for me. I saw some got snuck in there between others. Keep. I'm feeling like keep is the winner. Is that what other people are seeing too? Okay, we're going to keep it there. Thank you all for a great discussion around this topic. I think it is really important to like think about that there's many ways that you can think about impact. I'm going to shift us over here. And we're going to look at the other side of the board, but you can still talk about any sticky that you want. If you're like, oh, wait, I didn't get to talk about mine. That's fine too. But on this side of the board, this is proposed to be a little bit more difficult for Title V to change or expand. And then we have, of course, where it is vertically, if it's up at the top, we're proposing that it would make a big impact if we addressed it, and then some impact at the bottom. So take a quick peek. I'm going to take a look and see. I'm going to, zoom in a little bit, and I'm going to move this up just so we can see it a little better. Are there any? I can read them off too, but as I read, if there's anyone that you feel like you want to propose that you want to propose be in a different spot, please let me know. Why does that do that? I'm sorry, everyone. I don't, Miro. Okay, so we have social determinants of health needs difficult to address. That was a challenge that was identified. For number 9, it's financially difficult for clinics to maintain a care coordinator position. Number 10, communication challenges between healthcare settings and system players impact care coordination. 11, care coordination and accessing specialist referrals is difficult in rural areas and requires lengthy travel. 12, there's staffing shortage in clinics that divert care coordinators' attention away from coordination tasks. 6, care coordinators have high burnout, turnover and burnout rate. 7, care coordination is very challenging for children with special healthcare needs. 13, difficult for practices to stay up to date with patient contact information. And then 14, onboarding for new care coordinators is a lengthy process. Oh no, other people are having. So yeah, apparently there's a VPN issue with the state of Michigan.
Yeah, I think people are just popping in and out.
Okay,
And I think some have restarted their computer and it seems to be a fix, so I'm not sure if that's an issue.
okay. Yeah, I know that Jessica said that they were having troubles with that as well. If you do have to restart your computer and pop back in, I totally understand. Sorry about that. That's frustrating. So after taking a look at this board, are there any stickies that you all feel belong in a different place? Maybe number 6, Tia? Can you come off mute and explain why you're thinking it and where you might propose it would go?
So right now it's in the middle, saying that it could possibly be closer to being easier to change.
Yes. Not quite. It's still difficult. It's in the difficult section,
Right.
but it's a little bit easier than maybe some of the others.
I don't know how we would, I don't know. I think it might be more difficult than where it's placed. Maybe that's all
Oh,
I'm
okay.
thinking.
Okay. So potentially shift it over to the left.
Yeah. But I guess it kind of, the burnout, it happens because of all those things that are already on the list, basically. Staffing shortages, difficulty to keep in position, those all cause burnout. So if we don't do anything, or if there's no way to impact those other things, then we will continue to have a high turnover or burnout.
Okay. So thank you, Tia. So we're gonna say the proposal is to shift it maybe over to the left to like put it with the others, maybe next to 12 and 11. And sorry, you can't even read that, 10. So we're gonna put keep or move in the chat. I'm seeing some moves. Okay, I'm gonna shift you over. Any others that feel like they might need a little bit of an adjustment? Should be moved to a different section. Number 10. Okay, 2 for number 10. So number 10 is here. Communication challenges between healthcare settings and system players impact care coordination. So Julia shared that Title V might not be able to impact communication with all system players, but they might be able to have impact on communication with public health and maternal child health programs. I think it might be less difficult than is noted on the grid. And then Monique echoed that it might be long a little closer to the middle. Title V has some unique levers in this space, and they can convene partners, support referral standards, pilot communication improvements. It may be more influenceable than challenges like rural provider shortages or workforce gaps. Thanks, Julia and Monique. So can I ask you both, are you proposing that it shifts over the line to something that is maybe easier for them to address? Or do you think it should stay in the difficult most impact? I want to make sure we have our proposal clear so that folks can vote on it, like where it should go.
I would propose shifting it over the line.
Okay. All right. So this is the one. You can see me moving it. I'm going to inch it close to the line. Does it move over the line based on what they proposed? So you can say either keep or move in the chat. Is it something that might be easier for Title V to address because they have partnerships?
So you thought it should go in quadrant A, Julia?
Yep.
Okay.
Yeah, I'm seeing some moves. If anyone disagrees, I'm just going to start putting them here. Now, once they're in there, it doesn't really matter where they are at this point. We're going to vote on them. So I'm just going to stack them in there right now. Okay, thanks. If anyone disagrees, you can come off mute. Speak now, forever hold your peace. Okay, so this is going to be sort of our last call, given the time, for moving stickies. Is there anyone that's really, it's been burning, is sticking out to you? And if you're like, I'm not sure, but I do have a comment to say, like, we want to hear it. This is definitely the time to like share. If there's one that's really just kind of burning in your brain. Okay. Where's my poll? Okay, so here is what we are going to do. So I really appreciate you all talking through this. We are going to vote now on the two I'm going to zoom in. So this is the ones that we all have agreed. Can somebody, whoever's in there, can we click out of it if someone's clicked in there so it makes it not highlighted? My team, thank you. Okay, so you can see these are the 1, 2, 3, 4, 5, 6 sort of strengths or challenges that you all have shared would make the most impact and might be easier for Title V to either expand if it's a strength or address if it's a challenge. So now what we're going to do is I want you to take a look, and I really want you to think about 2 of the choices that you feel are the most important for Title V to prioritize right now in this moment in time. Considering all the factors that we know to be true, the strengths that we have talked about, the challenges of our times, and which ones do you feel like are most important for Title V to move forward right now within these 5? And you're going to pick your top 2. So please only vote for 2. And I'm going to have a couple of, go ahead and launch the poll, and we're going to have 2 minutes to vote. And these 2 priorities that you all propose and vote on to move forward will then move forward to we'll do a root cause analysis, and then we're also going to then start developing like key strategies and recommendations for actions that can be done, strategies that can be done to really help make impact in these areas. Okay, so I'm going to go ahead. I've launched the poll, so please vote for the top 2 choices you would like to see Title V address first. And so you're going to see the numbers only, and they correspond to the numbers on the sticky notes. And if you have any trouble, please just let me know in the chat or unmute yourself. zoom in maybe a little bit more. So about half of our friends who have voted. Give us about 1 more minute. Okay, I'm going to close the poll, so get your last choice in. And we are going to then show the results. So it looks like, if anyone hasn't voted, let me know. All right. Oh, you little.
Do we
Yeah.
want more MDHHS partners to vote?
Yeah, we might do that. We might do that. I think that's a great idea. So I think what we'll likely do is we'll share this out. So I'm going to share the results with you all right now. We do have a tie, so that's actually going to be very helpful. So the folks that aren't in the room, we might give them an opportunity to do that. So the results right now are we have 2 and 3 are sort of the top 2, non-Hispanic Black families and providers, but then you can see that number 1 is also very high up there. So we can
Number
take
10 has 5.
what? Oh, I'm so sorry. Just kidding. Number 10 has 5. Okay, that's the 1. And then we have a tie at 2 and 3. Thank you. It didn't scroll down far enough. But yeah, I think that is a good point, Sarah, is we have folks not in the room. Maybe we want to let them vote too. So so that's what we have for now. And we're going to take that information and then we're going to do a similar process for the second medical home element. I'm going to stop sharing. So I appreciate you doing that. This one has less sort of challenges and strengths. So I think that it's likely we'll have some good conversation, but might go a little bit faster. So this is our shifting gears to, it's the same process that we're going to use. And then we will talk through where we feel like things would go. We'll make proposals again, and then we will do a similar process of voting. So for this one, this is all about compassionate care that centers family and their culture. And so these are the different either strengths or challenges that were uplifted that were associated with them. And again, this is just a proposal about where they go based on proposed impact level and how easy it would be for Title V to change or expand. So I'm going to zoom in. I might just, for the sake of time, have you all look at the entire board. And we can take a quick peek if you want to look at section A first and see it, and we can go through that, but I'm going to keep the whole board up so you all can sort of read through at your leisure. But we'll walk through each one and you can tell me if there's anything that is confusing or needs clarified or if you have proposals. Yes, Sarah, and if you need me to zoom in, I'm happy to do that too. So number 1, interactions with front office staff greatly influence families' experiences receiving care. Parents really value being respected partners in their child's health care. Number 2. Number 3, Hispanic and non-Hispanic Black families are less likely to report receiving family-centered care compared to non-Hispanic white families. 4, providers and staff need additional support and education in providing family-centered care. And number 5, families are often not aware of what a medical home is and the services that are provided there. So we can sort of take a peek at these 5 to start. Does anyone either have questions about why we put something where it is, or have a proposal for something to be shifted and moved to a different section?
This is Tara. I feel like number 1 and number 2 are, well, I guess I'll focus on number 1. It feels like number 1 is more difficult for Title V to impact. It's not like we are, part of that administrative staff training or educating. I'm not familiar with any education initiatives that we have that go straight to like office staff, front office staff. That feels a little more difficult to me than in the easier quadrant.
So where, Tara, are you proposing that we shift it to for clarity?
I think I would move it across the line to like, I think difficult.
Okay, so move it to B, quadrant B.
Yes, please. Yeah. That's what I'm
Okay,
thinking.
perfect. So the proposal is to move number 1 to quadrant B. So let's take a vote, move or keep. Please put it in the chat.
We're moving it to the more difficult, is that
The
correct?
proposal is to move it over here to more difficult. Move it to B. So either move it to B or keep it in A.
It's moved to B. Does that then mean it won't be getting voted on?
Correct. Yep. Okay, so last votes. Okay, I'm seeing, can I change to Keith? Okay, what is it? 1, 2, 3, 4. Okay, we got a tie, I'm thinking. All right. All right, keep people, can you explain? Why,
Well,
why are,
I
I've left,
remember the survey that was done. I think like the interactions with office staff was like a number 1 or 2 on there from what people had said as far as impact. And I think it would make a big difference if we could offer those workforce development, trainings in order to give a better experience for the parents, which will in turn have them bring the children back more because they're having more positive experiences, with the medical facilities. So that was my reasoning.
thanks, Tia. All right, do we have a final count? Did keep win?
Yeah, it looks like
Okay, we're keeping it. All right, thank you for your idea to move. I think we're gonna go with the majority and we'll leave it in there for the vote. Any others in this section that feel like they might need to go into a different spot?
Maybe number 5.
Okay, this one is,
Yeah,
where would
family
you
card.
propose?
are
that it
not
would be moved.
aware, are not aware. I mean, I could see us having an awareness campaign, but as we had some parents speak to the idea that, you know, they saw signs on the, all they saw was some signs on the in the offices, but it didn't really impact how they were feeling about the office, right? Their experience with the office was more important than an awareness of whether it was a patient-centered medical home or not. At least that's how I remember having that conversation. So I would just put it down in the lesser impact of the awareness of a medical home.
Okay, so the proposal is to take 5 from A to D. Okay, let's take it to a vote. Are we keeping it in A or are we moving it down to D?
This is Tara. This is a hard one for me because I don't disagree with your statement. And I feel like this is an area. So when we report on what Title V does, this is kind of like a measurable that's relatively easy to measure. And so I don't disagree with you on the impact at all. I just worry that we're removing one of our opportunities to measure what we're doing. Like when you think about measuring some of the other things, it's difficult to get that measure, but surveying families about whether or not they're in a medical home is easy. So I said keep, but it's not that I disagree necessarily with your statement.
What does moving it down to D do, I guess?
So it shifts it down and then we're focusing on only those items in quadrant A to vote on to move forward.
Okay.
So it looks like keep right now is the winner unless others want to vote in the chat. So if you want to vote to move or keep it and you have not done that before, or maybe you've heard something that's changed your mind, you can put that in the chat. Otherwise, I'm keeping it. Okay, let's take a look. Look a little bit more. I'm going to zoom in. Anything else that needs to be moved around? Isn't in the right spot?
So I think number 10 kind of goes along with number 2. So that should be moved up. And I know it's a smaller margin, but it's kind of, I don't know. In my opinion, the accessibleness for the lower populations end up being bad, like it can be utilized and is better for all involved. So
Kara, just so I understand, your proposal is to take, is number 10 and move it up to A.
correct.
Okay, so that would be children with special healthcare services, educational programming helps parents of children with special healthcare needs build confidence and skills in managing their child's healthcare. So that's a strength. And the proposal then would be to work on expanding that. And so the proposal is to take 10 and shift it up to A. So let's vote on that. Move or keep for number 10. Keep it where it is or move it up to A.
I agree with the 9 being the peer-to-peer, and that could work as number 10 too, in all honesty. It's just the more education and the support that families have, the stronger advocates they can be and would be respected more.
Mhm.
So maybe move 9 instead of the 10, because I know 10 is only for the smaller margin.
Okay, Kara. So for, it looks like a couple of people said keep it where it is. And I know there's some sort of overlap with number 9, using peer-to-peer models as a promising approach for developing families' advocacy skills. So maybe enhancing that, expanding it, increasing access to it for others. And Monique suggested moving it up to A. Are you all, how do you feel about that? That's a new proposal, moving 9 up to A. So Dr. Gilmer says keep 10, move 9. It looks like we're good with moving it up. Okay, I'm moving it. I'm moving it, y'all. That's what we're doing. Okay.
This is just an observation too, but like to Tia's point, it feels like also, I mean, because I know we're gonna be like voting, but just as a reminder, like we're retaining all this information. And I would just say it seems like there's overlap, you know, and potential connections between some of these. So it seems like, you know, there's alignment between 1, 2, 3, and 4. You know, like Tia said, there could be alignment between like 5, 9, and 10. So I just want to like put it out there that even though we're going to be like the group's going to be voting on these things, we're not like losing all of this information that can potentially be used to inform the work moving forward in complementary ways.
Thanks, Sarah. That's a great point. I think once we start looking at strategies that we come up with, likely those strategies will address multiple pieces. So I think that is really important to note, and I appreciate you saying that. Okay, last call. So it's 12:23, last call for movement on this board before we vote. Okay. We are going to do the same process. And I'm going to launch the poll. So remember, you're going to pick the top 2 that you feel would be the most important for Title V to change or expand or work on first. And then we'll give others the opportunity to add to this poll as well. But we want to capture those in the room. I'll zoom into A so you can see a little bit better. So you'll vote on your top 2 choices. Okay, last call for votes.
Lindsay, can you send me to the poll again? Somehow I only
Oh,
voted once. I don't
can
know what
you,
happened.
can you put your other one in the chat? I don't know how to, wait, hold on, let me see if I can, oops. Well, that's not helpful.
Okay,
Can
never
you-
mind.
Can you scan that? Sorry, I don't know if you can try and scan that. I don't know, I've never done that.
Right, I don't know what happened either. Never mind. I don't want to mess
Do you
stuff up.
wanna, no, can you just put it in the chat, Kara?
Yep.
For your other choice? Okay. And we can add it. So my team, if you could mentally add this in or like take notes of this, and then I can. Okay, so I'm gonna end the poll. And then we're gonna share our results. So right now we have for number 4, providers and staff need additional support and education in providing family-centered care. That one was the top vote among this group. And then the second one was number 3, which is Hispanic and non-Hispanic Black families are less likely to report receiving family-centered care compared to non-Hispanic white families. And then we do have some close ones as well. And again, we'll allow other folks to vote on this too. So results may switch just a little bit depending on how other people go. But I really appreciate you all taking the time to have these really rich discussions and helping us narrow down the focus for Title V. And then what's going to happen next time, just to give you a little preview, we are going to work on root cause analysis for those that were selected. Can I see, I'm just going to take a little poll here. Can you raise your hand if you've done a root cause analysis before? Virtual hand or raise your, just kind of seeing, okay, I see a few. Okay. Yeah, so next time we're going to reveal the final results of the poll and we're going to work on a root cause analysis. So really trying to drill down like what specifically do we want to focus on? What are the causes of these not problems, but this issue, or what really contributes to a strength working really well? And so that way we can develop really actionable strategies and solutions for the 4 that were selected. And so that will happen on our next meeting on September 3rd. So we're really excited for that. So please make sure to come to that one. We're going to talk about root cause. We'll teach you how to do it if you haven't done it before, and then we'll work through this together. And then we'll start developing our strategies. So that's a sneak peek of what's to come. We really, really appreciate your hard work. And we want to ask you to complete the evaluation. We want to hear how this felt for you, what things we could do to improve for next time, and as we move forward together. So if one of you could put the evaluation link in the chat, and we'd love it if you could fill it out. We'd really appreciate that. Tara, I see your hand is up. Do you have a question or comment before we go?
No, sorry, I just forgot to lower it.
Oh,
Sorry.
that's okay. Okay, no problem. All right. Well, thank you all very much. We hope that you have a really wonderful day, and we'll look forward to seeing you next time.